Unspoken loss. Understanding miscarriage, recognizing symptoms and finding treatment. What is miscarriage? Miscarriage is a medical condition that occurs when a pregnancy is lost before the 20th week of gestation. There are many potential causes of miscarriage, including genetic abnormalities, hormonal imbalances, infections, medical conditions in the mother, and lifestyle factors. In early pregnancy, chromosomal abnormalities are the most common cause of miscarriage. These can occur when the fertilized egg has an abnormal number of chromosomes or when there are errors in the way the chromosomes divide as the embryo develops. Hormonal imbalances, such as low levels of progesterone, can also lead to miscarriage. Progesterone is a hormone that helps to support the growth and development of the pregnancy, and if levels are too low, the pregnancy may not be able to continue. Infections, such as bacterial vaginosis or sexually transmitted infections, can also increase the risk of miscarriage. Medical conditions in the mother, such as diabetes or thyroid disorders, can also increase the risk. Finally, lifestyle factors such as smoking, alcohol consumption, and drug use can increase the risk of miscarriage. Miscarriage symptoms. Symptoms of a miscarriage can vary from person to person, and not everyone who experiences a miscarriage will have the same symptoms. Some common signs and symptoms of a miscarriage include vaginal bleeding. Spotting or heavy bleeding can be a sign of a miscarriage. Bleeding can occur at any time during pregnancy, but it is most common in the first trimester. Cramping. Mild to severe cramping in the lower abdomen can be a sign of a miscarriage. Passing of tissue or clots. Passing tissue or clots from the vagina can be a sign that a miscarriage is occurring. Loss of pregnancy symptoms. If you experience a sudden loss of pregnancy symptoms, such as nausea, breast tenderness, or fatigue, it may be a sign of a miscarriage. Pelvic pressure or discomfort. Some women may experience pelvic pressure or discomfort during a miscarriage. Miscarriage causes. Miscarriage can occur due to various reasons, and in many cases, the exact cause of a miscarriage is not known. Causes of miscarriage include chromosomal abnormalities. The most common cause of miscarriage in the first trimester is chromosomal abnormalities in the developing embryo or fetus. This can occur due to problems with the division of chromosomes during fertilization or in early cell division. Hormonal imbalances. Hormonal imbalances, particularly a deficiency in progesterone, can cause the uterus to contract and expel the developing fetus, leading to a miscarriage. Infections. Infections of the uterus or cervix, such as bacterial vaginosis or sexually transmitted infections, can increase the risk of miscarriage. Medical conditions. Certain medical conditions such as diabetes, thyroid disorders, autoimmune diseases, and blood clotting disorders can increase the risk of miscarriage. Physical trauma. Physical trauma, such as a car accident or a fall, can cause a miscarriage. Abnormalities of the uterus. An abnormally shaped uterus or fibroids can increase the risk of miscarriage. Miscarriage treatment. The treatment for miscarriage depends on several factors, including the woman's health, the gestational age of the pregnancy, and the extent of the miscarriage. If a miscarriage is incomplete or there are signs of infection, medical intervention may be necessary. Treatment options for a miscarriage may include expectant management. In many cases, the body will naturally expel the fetal tissue, and the pregnancy will resolve on its own. This process can take several days to a few weeks. During this time, the woman may experience bleeding and cramping, and she should rest and avoid strenuous activity. A healthcare provider may monitor the woman's condition through blood tests and ultrasound exams. Medication. Medications such as misoprostol may be prescribed to help the body expel the fetal tissue. This medication can cause cramping and heavy bleeding, so it is important for the woman to rest and avoid strenuous activity during this time. Surgery. If the miscarriage is incomplete or there are signs of infection, a surgical procedure may be necessary to remove the remaining tissue. This procedure is called a dilation and curettage (D&C) and is usually performed under general anesthesia. In addition to these medical treatments, emotional support and counseling may be helpful for women and their partners who have experienced a miscarriage. It's important to allow time for grieving and healing after a miscarriage. Thanks for watching. Please do like, subscribe and click bell icon for more health videos. Also lets us know How would you want us to improvise videos, or which health condition you would like to explore in comment section?